Maryland marks another serious milestone, surpassing the 70,000 mark for confirmed COVID-19 cases. Despite that, the number of people in the hospital still follows a positive trend. The state as a whole seems to be on the right track, but there are some zip codes dealing with a recent spike in positive cases. That includes parts of Canton, Highlandtown, and East Baltimore. People in the Black and Latino communities make up the majority of people who have been infected. Baltimore City's health commissioner explains why.
These communities tend to be in more densely populated areas. They tend to live in multi-generational housing. We still urge residents and business owners to be vigilant.
She says people need to keep washing their hands and wear masks. The state is doing more testing now. Some areas like Baltimore City are providing hotel rooms so people can self-quarantine if they get sick. College life will look and feel different this fall. It was just announced at the University of Maryland that large classes will be held online. Only a small fraction will be taught in person. WJZ is live. Amy Kawada explains the changes impacting students. Good morning, Amy.
Yeah, good morning, Lynn. These changes announced by UMD are all to really help with following social distancing guidelines. And similar changes will also be made right here at Johns Hopkins University, which means that this upcoming fall semester, some students might not even have to step foot on campus. It's a precautionary step to keep students safe.
It's just such a different experience.
On Tuesday, the University of Maryland College Park notified students of its plan to hold only about 20% of undergraduate courses partially in person this fall due to coronavirus. The school says this decision was made because of classroom sizes and social distancing limits. Courses with more than 50 students will be taught online. Things like labs, performance courses, and clinical instructions will be given the priority for in-person learning.
I don't think the learning is quite as efficient because you can't really talk to your professors or like other students because you're again on your computer.
UMD is just one of several universities across the country forced to adjust because of the pandemic. Johns Hopkins University announced students returning to campus this fall will be required to follow mandatory safety rules like wearing masks and social distancing. Class sizes will also be limited. Some will be offered exclusively in person, but most will be offered online.
I definitely think it's a good idea because I think it's safer for the students if they can work from home.
The school also announced all courses will be online following Thanksgiving break.
I'm just hoping we can figure something out.
At both UMD and Johns Hopkins University, dining halls will have limited capacities, so you can expect more grab-and-go options. Also, on-campus housing will be altered to comply with social distancing guidelines. Live from Johns Hopkins University, I'm Amy Kawada for WJZ.
Amy, thank you. Men and women are equally as likely to contract COVID-19, but new studies show men are being hit harder. Doctors say it appears to come down to genetics. Women are better at fighting off viruses than men. A study of 5,700 hospitalized patients in New York City showed more than 60% were men. And another study suggests men are twice as likely to die from the virus than women.
Women have a better response to infections than men do. Their immune system is more revved up to deal with infection.
Doctors say a woman's estrogen level also helps her fight the disease. Women also tend to recover from COVID-19 faster, leaving less chance of complications to arise. Doctors urge men to be extra vigilant in taking precautions. The roulette wheels are spinning and the slot machines are back on at casinos in Maryland. After being shut down for 3 months due to the pandemic, the state's 6 casinos have been welcoming back guests under a new normal. But nearly a month since reopening, casino revenue is still taking a hit.
Will probably be something like $190 million less than we were last year, where we did about $1.3 billion in total aid to the state of Maryland.
Last month, the 6 casinos generated nearly $35 million and contributed more than $14 million to the state. That is far less than the $143 million made in June of 2019, when $60 million was sent to the state.